Welcome to FitTEST Solutions. My name is Jennifer Gamboa, and I'm one of the developers of this web-based application designed by physical therapists for physical therapists to conduct credible, evidence-based fitness physicals and exercise prescription. So why FitTEST Solutions? In short, because while there are many in the community who advise exercise, very few have the knowledge, skills, and abilities to specifically prescribe exercise to meet individual health, disease risk management, and social support needs. Physical therapists do. We have a serious shortage in the U.S. of one of the lowest cost medicines available for preventing and managing chronic disease. That is exercise. Physical inactivity is a leading cause of death in the U.S. due to heart disease, stroke, diabetes, and cancer. Physical activity is critical in the prevention of the detrimental effects of aging, obesity, and chronic illness. Despite well-documented evidence of the benefits of physical activity, we have yet to reach CDC, ACSM physical activity recommendations that were published over a decade ago. Why? On our way to answering this question, let's consider some additional numbers. 1 to 6 of 10, 40 and 40, 50 in 6. That is, health clubs lose 1 to 6 of every 10 members. On average, gyms experience a 40% attrition rate annually, and 40% of American adults do nothing to exercise. 50% of individuals starting an exercise program drop out after 6 months. So in a health club environment, in January the treadmills are full, and by October there's a significant drop in membership. Well, what are the barriers to becoming a successful and committed exerciser? To begin with, the belief that health behaviors are unrelated to disease, or that the costs of fitness outweigh the benefits. Also, lack of social support, fear and lack of confidence, discomfort at the anaerobic threshold, unclear and ambiguous guidelines, and failure of providers to link exercise prescription to consumers' own perceptions of health and illness. Considering the barriers to successful exercise, who is the target population for physical therapist-centered fitness? Avid exercisers, or those who may drop out, or those who never begin? Each provider may answer this question differently depending on the needs of their patient population. Our patients and clients bring certain exercise attributes to the table, including intention, personal capabilities, behavioral skills, and commitment. Providers can significantly influence consumer behaviors and the likelihood of successful exercise through their own attributes, including reinforcement and support, directed programming, specific goals, and clear data. But who really does this in our community now? Some PTs assume that these needs are being met by other community providers. In the summer and fall of 2009, we took a look at what was actually available in 5 different communities. We sampled 55 facilities, including 1 PT-owned facility, 24 big box national chains, and 26 local clubs. Of the 55 facilities surveyed, 49% established some baseline fitness. But what was that? The objective tests and measures, only 29% collected weight and BMI. 24% tested endurance. 22% tested strength, but there was no consistent methodology. 20% had height information. 11% had flexibility. 11% collected an injury history. And 11% tested percent body fat. Of the 55 facilities, only 24% had a known standard for trainer certification, and of that, only 4% had advanced degrees. What about follow-up? Only 15% of the facilities scheduled routine follow-up, although 31% said that it was available upon consumer request. Physical therapists are ideally suited to meet the public health challenge of insufficient and unsuccessful exercisers. However, we do need to look beyond our traditional silo of impairment-based treatment and embrace the intersection between PT, health promotion, and fitness. Essentially, physical therapists have the opportunity to build relationships for life, case managing along a continuum of impaired function to successful, committed exercise. The essential elements that physical therapists bring to the fitness marketplace include clear, credible data, specific goals, and directed programming. Consider the critical elements of an individual's health profile that could influence the ability to be a successful and committed exerciser, including information in the current health profile, leading risk factors, a medical and injury history, what stage of cognitive and behavioral support needs someone has, biomechanical information, strength and flexibility data, norm-referenced functional testing information, endurance capacity, and the ability to receive specific program planning for each of those elements. Traditional community testing falls well short of collecting data in each of these critical areas. Physical therapists are extremely competent and routinely collect data in these testing areas. PTs have an opportunity to fill a tremendous void in the fitness health promotion marketplace. But we do have some marketing and presentation challenges to overcome. The health club industry is slick, consumer-friendly, and retail-oriented. How do we compete? This is where FitTEST Solutions can be an ideal tool for competing effectively in the health promotion and fitness marketplace. Using our web-based application, you can collect clear and credible data with easy data entry screens that include step-by-step instructions for each test and measure, as well as including the references so that you can look up the history of that specific test. FitTEST Solutions includes functional tests and measures that are benchmarked against national norms, and reliable and valid field tests for endurance testing in the clinic. FitTEST Solutions also provides turnkey reports so that you can generate snapshot reports that clearly identify red, yellow, and green flags and let the client know what their needs are. FitTEST Solutions generates reports with professional recommendations, as well as gives you the ability to track changes over time. You also have the ability to provide specific exercise prescription, including individualized prescription to meet goals and account for clients' healthcare needs as well as their psychosocial status. You can compile a home exercise program with a click of a button. Exercise instructions are included, but you can also customize for the client in front of you. So what happens to a practice when physical therapists enter the health promotion and fitness marketplace? You create multiple points of entry into your practice rather than the traditional impairment-based door to enter physical therapy. You have the ability to create cross-referrals and collaboration. Vibrant opportunities for becoming a continuous and ongoing resource for your clients rather than discharging them from your care after an impairment-driven intervention. Together, we have an opportunity to prevent disease, not just treat impairments. We can change healthcare as we know it, and FitTEST Solution is an important tool for that transition. Please contact us at info@FitTEST Solutions for some additional information about how you can become a key fitness and health promotion provider in your community.